All right, so get ready, because today we're going to do a deep dive on a story that's both fascinating and incredibly disturbing.
Yeah.
The case of Charles Cullen.
Yeah.
I think a lot of us listening want to understand
Uh,
how a seemingly ordinary nurse
right.
became one of America's most prolific serial killers. Honestly, it's a question that just grabs you and won't let go.
It really does. It really does. And, we're talking about someone who is entrusted with the care of the sick.
Right.
Someone who should be a symbol of healing,
Mm-hmm.
turning into an instrument of death. And the scale of it all.
Yeah.
Cullen confessed to 40 murders.
Right.
But some experts believe the true number could be in the hundreds.
Hundreds.
Yeah.
That's almost impossible to even
Right.
grasp.
Yeah.
So to help us kind of get a handle on this, we've pulled together a ton of research, articles,
Yeah.
court documents,
Yeah.
even excerpts from The Good Nerd, that book about Cullen by Charles Graeber.
Right.
Think of it like gathering all the puzzle pieces, and now
Yeah.
we're going to try to put them all together.
Exactly. We'll look at Cullen's life, his career, what might have been going on in his mind, and just try to understand the systemic failures
Yeah.
that allowed him to continue these horrific acts for so long.
Okay, so let's start at the beginning. What can you tell us about Cullen's early life?
Well, the sources kind of paint a pretty bleak picture.
Yeah.
His father, a bus driver, died when Cullen was just a baby, only 7 months old.
Wow.
And Cullen actually later described his childhood as miserable. He was bullied constantly.
That's heartbreaking, and tragically, it gets worse. When Cullen was just 9 years old, he attempted suicide by drinking chemicals.
That's right.
9 years old.
And then, as if losing his father at such a young age wasn't enough. When Cullen was 17, his mother died in a car accident.
Oh my gosh.
Yeah, he was devastated. And adding insult to injury, the hospital cremated her body without even telling him first.
That's awful. It's like one blow after another. Do you think these early experiences, especially the loss of both parents, played a role in his later actions?
It's impossible to say for sure, of course,
Sure.
but it's certainly worth considering how such profound losses, especially during those crucial developmental years, might have impacted him psychologically.
Yeah.
It's hard to imagine coming out of those experiences unscathed.
Right. It makes you wonder if those losses created some kind of void within him, a darkness that grew over time.
Yeah, it's certainly possible.
Yeah.
Trauma can manifest in many ways.
Of course.
And it's interesting to note that even during his tumultuous childhood, there were hints of his later obsession with medicine.
Oh, what do you mean?
Well, after his mother's death, Cullen actually worked as a lab technician at a chemical plant.
Okay.
So even his grief, there was this pull towards the scientific, the medical.
Wow. That's a really interesting detail, almost like a foreshadowing of his eventual career path, though obviously twisted into something much darker.
Exactly, yeah.
Yeah.
And then, of course, there's his time in the Navy.
Okay.
He served on a submarine, the USS Woodrow Wilson, which is an incredibly intense environment to begin with.
Oh, I can imagine. I can't even imagine the pressure and isolation of being on a submarine. Did anything notable happen during his service?
Well, there was this one incident where he was disciplined for wearing medical garb while on duty.
Really?
And nobody really knows why he did it,
Yeah.
but it's almost like he was fixated on the idea of medical authority even back then.
It's a strange detail, almost like he was drawn to the symbolism of it, you know? And his time in the Navy wasn't exactly smooth sailing, was it?
No, not at all.
Yeah.
He was reassigned to a supply ship after the submarine incident
Mm-hmm.
and had several more suicide attempts.
Oh my gosh.
Eventually, he received a medical discharge in 1984.
So we see this pattern of mental health struggles continuing. But despite all of this, he managed to graduate from nursing school just 3 years later, and even got elected class president.
Yeah.
It's such a stark contrast to the troubled person we've been discussing.
It is. It's a bit of a paradox, isn't it?
Yeah.
On the surface, he was succeeding, fitting in, even being chosen as a leader.
Right.
But beneath the surface, who knows what was going on?
It really raises the question, was nursing a genuine calling for him? A desire to help people? Or was there something more sinister at play? Did he see it as a way to exert power, to control life and death?
Those are exactly the kinds of questions we need to grapple with as we delve deeper into this story.
Yeah.
Because shortly after graduating, he started working at St. Barnabas Medical Center.
Mm-hmm.
And that's where the confirmed murders began.
So his first confirmed victim was in 1988, right? What happened?
Yeah. He administered a lethal overdose of medication to a patient.
Oh, wow.
Later on, he would confess to killing several others at St. Barnabas, including an AIDS patient who received a fatal dose of insulin.
It's chilling to think that someone entrusted with the care of vulnerable people could betray that trust in such a horrific way. And all of this was happening while he was married with a family, right?
Yeah. Yes. He had a wife and 2 daughters during this time.
Okay.
But it seems his personal life was just as troubled as his professional one.
What do you mean?
Well, his wife eventually filed for a restraining order, making some disturbing claims about his behavior.
Okay.
She said he would spike drinks,
Really?
burn his daughter's books, and even disappear for days at a time, leaving the kids with a babysitter.
Oh my goodness. Those are incredibly disturbing allegations. It sounds like he was spiraling out of control. Did he ever address these claims?
You know he denied them,
Okay.
but the restraining order paints a picture of a man who was clearly struggling both internally and in his relationships. It's almost like there were glimpses of this darkness that would eventually consume him.
And sadly, that darkness didn't stay confined to his home life. Despite investigations into contaminated IV bags at St. Barnabas, Cullen left and continued his killing spree at several other hospitals.
That's right.
It's awful.
And it's at this point that we start to see the truly horrifying systemic failures that allowed him to keep going.
Okay, so let's talk about those failures. What happened at the next hospital, Warren Hospital?
Well, at Warren Hospital, Cullen continued his pattern of administering lethal overdoses, this time using digoxin, a heart medication.
Okay.
He murdered 3 elderly women there.
It's just awful.
And what's even more disturbing is that one of his victims actually reported a sneaky male nurse injecting her. But her concerns were tragically dismissed.
Oh gosh, it's infuriating to hear that. A clear warning sign, and it was just ignored. It makes you wonder how many lives could have been saved if people had just taken those early warnings more seriously.
Absolutely. And it highlights a major problem at the time, a reluctance to believe that someone in a position of care could actually be harming patients. There was this inherent trust in healthcare professionals, which Cullen exploited time and time again.
Right. So despite the suspicions at Warren Hospital, he was able to move on to yet another hospital, Hunterdon Medical Center. It's almost like a terrifying game of whack-a-mole.
It really is.
Yeah.
At Hunterdon, he killed 5 more patients, again using digoxin.
Gosh.
And then at Morristown Memorial Hospital, he was actually fired, but not for anything related to the murders.
Oh, really? What was he fired for?
For poor performance.
Okay.
Things like failing to chart medications properly or not responding to pages quickly enough.
It's mind-boggling to think that he was allowed to continue working with patients despite those performance issues.
I know.
It's as if his ability to blend in, to appear competent on the surface, kind of shielded him from closer scrutiny.
Exactly.
Yeah.
And this pattern continued. He worked at Liberty Nursing and Rehabilitation Center, where he was accused of giving patients drugs at odd times, and a patient ended up with a broken arm after an encounter with him.
It's like a trail of red flags, but no one is connecting the dots.
Right. And tragically, a patient's death at Liberty was blamed on another nurse, even though evidence later suggested that Cullen was likely responsible.
Oh my gosh. So not only was he getting away with murder, but his actions were also leading to other healthcare workers being wrongly accused. It just adds another layer of tragedy to this whole story. And it doesn't stop there, does it? He went on to work at Easton Hospital, where he killed another patient, though the investigation couldn't definitively prove it was him.
Yeah.
It's a testament to the lack of communication and accountability in the healthcare system at the time.
Right.
There was no centralized system for tracking suspicious behavior, no easy way for hospitals to share information about potentially problematic employees.
Exactly.
So hospitals were essentially operating in silos, allowing someone like Cullen to move freely from one to the next, leaving a trail of death in his wake. And on top of that, it seems like hospitals were more concerned about avoiding lawsuits than about protecting patients.
Yeah, that's a key point. The fear of legal repercussions often trumped the moral imperative to prevent harm.
Right.
It created a culture of silence where people were hesitant to speak up, even if they had suspicions.
It's a chilling thought. And tragically, Cullen's story continued at Lehigh Valley Hospital, where he killed one patient and attempted to kill another before resigning and moving on to St. Luke's Hospital.
Right at St. Luke's, the body count continued to rise. He murdered at least 5 patients there and attempted to kill 2 more. It's almost incomprehensible how he was able to keep doing this, given the mounting evidence against him.
You mentioned earlier that Cullen had a history of suicide attempts. Did any of those attempts happen during his time at these hospitals?
Yes. In fact, while working at St. Luke's, he tried to kill himself by lighting a charcoal grill in his bathtub.
What?
Yeah, his neighbors smelled the smoke and called the authorities, and he ended up being taken to a hospital and then a psychiatric facility.
It's almost surreal that he was being treated for suicidal tendencies
Mm.
while simultaneously engaging in homicidal behavior. Did no one suspect a connection?
It seems not. The focus was on treating his depression and preventing him from harming himself, rather than considering the potential danger he posed to others. There was this compartmentalization of his mental health issues, a failure to see the bigger picture.
And tragically, despite all of this, he was able to move on to yet another hospital, Somerset Medical Center in New Jersey.
Right. And at Somerset, his actions finally started to raise serious red flags.
Okay.
Staff noticed unusual patterns in his behavior, like accessing patient records he shouldn't have,
Yeah.
and requesting medications for patients he wasn't assigned to.
It sounds like people were finally starting to pay attention. What were some of the specific things that tipped them off?
Well, the computerized drug dispensing cabinets showed some really suspicious activity.
Okay.
There were orders that were canceled immediately after being filled, multiple requests for the same medication within minutes of each other. Things that just didn't make sense in the context of normal patient care.
It's like a digital trail of his crimes was starting to emerge. Was this the turning point?
It was certainly a significant development.
Yeah.
In July 2003, the New Jersey Poison Information and Education System actually warned Somerset officials about suspicious overdoses that pointed to a possible killer on staff.
So the alarm bells were finally ringing. What happened next?
Well, in October 2003, a patient died of low blood sugar at Somerset.
Okay.
This was Cullen's last victim, and it finally prompted the hospital to contact the New Jersey State Police.
So after years of getting away with murder, it seems like the walls were finally closing in on him. But how did they actually catch him? I understand a coworker played a key role in his capture.
You're absolutely right.
Yeah.
A nurse named Amy Loughran, who had worked with Cullen at Somerset and considered him a friend, became increasingly suspicious of his behavior.
Okay.
She was instrumental in helping the police gather evidence, even wearing a wire to record conversations with him.
Wow, she must have been incredibly brave to do that. It sounds like she put herself at risk to stop him.
She absolutely did, and her courage was crucial in bringing Cullen to justice, based on the evidence she helped gather. The police finally arrested Cullen at a restaurant on December 12, 2003.
So after years of evading detection, he was finally caught. What happened next? Did he confess?
Yes, he did.
Okay.
Just 2 days after his arrest, Cullen admitted to murdering Florian Gall and attempting to murder Jin King Han, both patients at Somerset.
Wow.
But what's truly chilling is that he confessed to far more than just those 2 cases.
How many did he ultimately confess to?
He told detectives he had murdered as many as 40 patients over his 16-year career.
Oh my gosh, that's a staggering number. 40 confirmed victims and potentially hundreds more. It's almost impossible to comprehend the scale of his crimes. Did he ever offer any explanation for his actions? Why did he do it?
Well, that's where things get even more complicated.
Okay.
Cullen has given conflicting statements about his reasons for killing, making it difficult to pinpoint a definitive motive.
What kind of things did he say?
At times, he claimed he wanted to save patients from suffering, and what he perceived as dehumanizing treatment by hospital staff.
Okay.
He said he overdosed them to spare them from going into cardiac or respiratory arrest, which he couldn't bear to witness. But not all of his victims were terminally ill or in unbearable pain.
Right.
Some were expected to recover fully.
Wow.
And some investigators believe Cullen may not have always been fully aware of his victims' level of suffering, which contradicts his mercy-killing claims.
So it wasn't always about easing pain or ending suffering. It seems like he was playing God, deciding who deserved to live and die, even when patients had a chance of survival.
It's a disturbing thought.
It is.
And what makes it even more perplexing is that Cullen also described his murders as impulsive.
Yeah.
Even though he would sometimes observe his victims for days before acting.
So which was it? Premeditated or impulsive? Mercy killing or something more sinister? Did he even know why he was doing it?
It's hard to say for sure. Cullen has said he lived most of his life in a fog and has blacked out memories of many of his murders.
Wow.
He claims he can't recall how many he killed or why he chose certain victims.
Okay.
In some cases, he'd even deny committing any murders at a particular hospital. then later admit to it after reviewing medical records?
It's like he was compartmentalizing, almost as if he was trying to distance himself from the reality of his actions. What do you make of that from a psychological perspective?
It's possible he was using dissociation as a coping mechanism,
Mm-hmm.
a way to protect his psyche from the enormity of his crimes.
Yeah.
But it also raises questions about his mental state and whether he was truly aware of the consequences of his actions. It's a complex and unsettling picture.
Mm.
And ultimately, we may never fully understand what drove him to commit these horrific acts.
It's certainly a chilling reminder of the darkness that can reside within the human heart, even in those we entrust with caring for the most vulnerable among us.
Absolutely. And while we may never fully grasp Cullen's motivations, we can certainly learn from the systemic failures that allowed him to operate for so long.
So let's talk about those failures and the changes that were made in the wake of his crimes. After his arrest and confessions, what happened? What was the legal outcome? So Cullen confessed to 40 murders. He was clearly deeply troubled, but he was also able to exploit weaknesses in the system for years. What happened after his arrest? Were there any legal repercussions beyond his own sentencing?
Oh, absolutely. As part of his plea agreement, Cullen cooperated with authorities to identify additional victims. In exchange, he avoided the death penalty. Ultimately, he was sentenced to 18 consecutive life sentences in New Jersey and another 6 life sentences in Pennsylvania. He won't be eligible for parole until 2403.
Wow. So he'll effectively spend the rest of his life behind bars.
Right.
But his case had a much broader impact, right? It forced hospitals and lawmakers to take a hard look at how something like this could have happened and what they could do to prevent it from happening again.
Exactly. The Cullen case was a wake-up call for the entire healthcare system. It exposed major flaws in the way hospitals handled suspicious behavior, how they reported potential misconduct, and how they shared information with each other.
So it wasn't just one hospital or one state that needed to change. It was a systemic issue that needed to be addressed at a national level.
That's right. And thankfully, that's exactly what happened. In response to the Cullen case, both Pennsylvania and New Jersey, along with 35 other states, enacted new laws to address the very issues that allowed him to operate for so long. They realized they had to close the loopholes that Cullen had slipped through.
What did those legal changes actually look like? What were some of the key reforms?
Well, one of the biggest changes was a focus on transparency. Before Cullen, many hospitals were hesitant to share negative information about employees, even if those employees had exhibited concerning behavior. They were afraid of being sued for defamation or damaging someone's reputation.
So is a culture of protecting the institution rather than protecting patients?
Unfortunately, yes. But after Cullen states realized they needed to prioritize patient safety above all else. So they passed laws that made it legally safer for hospitals to be honest about an employee's past behavior, even if it wasn't flattering.
So no more sweeping potential problems under the rug out of fear of lawsuits.
Exactly. Hospitals were now encouraged, and in some cases, required to be more transparent when providing job references for healthcare workers. This made it much harder for someone like Cullen to simply move on to a new hospital without anyone knowing their history.
That makes sense. It's like creating a system of checks and balances to ensure that potentially dangerous individuals can't just fly under the radar. What other changes were made?
Another major focus was on strengthening reporting requirements. Before Cullen, there were often inconsistencies in how hospitals reported suspicious deaths or other serious incidents. Some hospitals might have tried to handle things internally without involving outside authorities to avoid bad publicity or potential legal trouble.
So there was a lack of standardization and accountability.
Exactly. But after Cullen, states like New Jersey passed laws like the Patient Safety Act, which made it mandatory for hospitals to report serious incidents, like unexplained deaths, suspicious medication errors, or anything else that might indicate potential harm to patients. There was no more leeway for hospitals to try to sweep things under the rug.
That's a huge shift. It sounds like they created a system where things couldn't just be ignored anymore. It forced hospitals to be more proactive in identifying and addressing potential problems.
You got it. And they went even further. Remember how Cullen was able to move from hospital to hospital without anyone having a full picture of his past? To address that, New Jersey created a central database where hospitals had to report detailed employee information.
What kind of information was included in this database?
It included things like employment history, any complaints filed against the employee, disciplinary actions taken, and the reasons for those actions. It was designed to create a more comprehensive record, making it much harder for someone like Cullen to slip through the cracks.
So thanks to Cullen, it sounds like the healthcare system is a lot safer today. These laws and databases have certainly made it more difficult for individuals with a history of harming patients to continue working in healthcare.
That's right. While no system is perfect, these changes have significantly reduced the chances of another Cullen-like case happening. They've created a safety net that didn't exist before.
It's both reassuring and heartbreaking that it took such a horrifying case, so many innocent lives lost, to bring about these changes.
It is a tragedy, and it's important to acknowledge the immense pain and suffering that Cullen caused. But it's also important to recognize that his case served as a catalyst for positive change. It forced the healthcare system to confront its weaknesses and to prioritize patient safety above all else.
Absolutely. So, having delved into this complex and disturbing case, what are some key takeaways you think our listeners should keep in mind? What are the most important things we can learn from Charles Cullen's story?
I think there are several crucial takeaways. First and foremost, Cullen's case highlights the critical importance of mental health awareness and support, both within the healthcare system and in society as a whole. Cullen struggled with depression and suicidal ideation for years, yet he was still able to obtain and maintain a position of power and trust within the medical field.
It makes you wonder how many other individuals might be struggling in silence, their cries for help going unnoticed.
Exactly. And it underscores the need for more robust mental health resources and support systems, not just for healthcare professionals, but for everyone. We need to create a culture where people feel comfortable seeking help without fear of stigma or judgment.
Absolutely. What else should our listener take away from this deep dive?
I think it's also crucial to recognize the importance of individual courage and vigilance. Amy Lofgren, the nurse who helped bring Cullen down, is a powerful example of someone who saw something wrong and chose to act, even though it meant putting herself at risk. Her bravery was instrumental in ending Cullen's reign of terror and potentially saving countless lives.
She's a true hero, and her actions demonstrate that even in the face of immense pressure and potential danger, one person can make a difference. Speaking up, even when it's difficult, can have profound consequences.
Absolutely. And finally, I think Cullen's case serves as a stark reminder of the importance of transparency and accountability, especially in systems of power like healthcare. For too long, concerns about reputation and legal liability overshadowed patient safety. But Cullen's crimes forced the system to confront those weaknesses and to implement reforms that prioritize the well-being of patients above all else.
So in a way, Cullen's legacy, as horrifying as it is also one of positive change. His case, though tragic, served as a catalyst for a safer and more accountable healthcare system.
That's right. And it's a reminder that even in the darkest of situations, there's always the potential for growth and improvement. We can learn from our mistakes, make changes, and strive to create a better, safer future for everyone.
That's a powerful and hopeful message. This has been a heavy but incredibly important deep dive, and I appreciate your guidance and expertise. Before we wrap up, is there anything else you think our listeners should explore if they want to learn more about this case?
I'd highly recommend The Good Nurse by Charles Graeber. It's a meticulously researched and gripping account of Cullen's crimes and the systemic failures that allowed him to operate for so long. It also delves deeper into the psychology of healthcare serial killers, a chilling but fascinating subject.
That sounds like a must-read for anyone interested in true crime and the complexities of the human psyche.
It definitely is.
Well, thank you again for sharing your insights with us today. It's been a sobering but ultimately enlightening conversation. And to our listener, we encourage you to continue exploring this case, to stay curious, stay informed, and most importantly, stay safe.